We're going to go ahead and get started. I know people are still logging on. We have information today about Phelan-McDermid syndrome, and Carla is on, and she is a family support specialist for the Phelan-McDermid Syndrome Foundation. So I'm going to let her introduce herself and share her screen, and be sure and put any questions, comments in the chat, and we will get them answered as soon as we can.
Great. Thank you so much. Thank you so much for inviting me to speak today to you all for this Lunch and Learn. I'm excited to be here. My name is Carla D'Imperio. I am the Family Support Specialist for the Phelan-McDermid Syndrome Foundation, and I'm mom to Matthew, who is my 9-year-old son who has Phelan-McDermid Syndrome. So today I'm going to talk about who we are as a foundation, share a little bit about what we do, and also talk about Phelan-McDermid syndrome and the diagnosis and what our population and our work looks like specifically in Florida. My family lives in Tarpon Springs. I'm just going to share my screen real quick and show you. You can write my email address down if you'd like. I'll share it again and I can put it in the chat. There's my family. My husband is an assistant state attorney in the 6th Circuit in Florida. So that's Pasco and Pinellas County. We live in Tarpon Springs. My son Joseph is about to turn 12. He just started 6th grade, and my Matthew is in the picture of the family. He's always watching his screens, watching his devices. So I put another big picture of his beautiful face. He's 9, and he was diagnosed with Phelan-McDermid syndrome when he was 15 months old. And then my little girl Jane is about to turn 7. So we are a busy family. We're in a kind of a busy time of life. And, really, my kids are all in public school. So I can speak to a lot of what Florida has to offer families if you're willing to advocate and put up a bit of a fight to get what you need, which I'm sure you all know what that's like. So I am going to stop with I'm not going to have like a formal slideshow presentation, but I am going to share my our website and talk through some things on the website to share my information. I also, if you want to show your video, that would be lovely to see your faces. If you want to interrupt me, you're welcome to unmute and ask a question. You don't need to raise your hand or put it in the chat. So happy to support you all in whatever way works for you. So let me grab my website. So I'll start with just a little bit of background about us and who we are as a foundation. And then I'll kind of get into Phelan-McDermid syndrome and give you some information about that. So Phelan-McDermid Syndrome Foundation, our mission is to make today better and the future brighter for everyone living with Phelan-McDermid syndrome, from the moment of diagnosis to the delivery of treatments and cures. So we're supporting not only the individuals who have Phelan-McDermid syndrome, but everybody affected by it, including the families, which is really my role primarily around family support. And we have kind of that 2-prong mission around supporting our families now with, what can we do to help alleviate symptoms and treatments now and improve the quality of life for the family in the moment, and also looking long-term towards the future. So we have a big science and research piece as well, which I'll get into a little bit. And our vision as a foundation is that Phelan-McDermid syndrome is treatable and curable, and every person and family affected is thriving. So we're always, working with that in mind. The Phelan-McDermid Syndrome Foundation is based out of Florida. We have a little tiny office in Osprey, Florida, which is just outside of Sarasota. And that being said, it really is just a little tiny office. Our staff is all over the country. We have a staff of about 10, in addition to different contracts and different folks we work with in a less formal basis. We are an international organization, so we do have families and members throughout the world. So do you have a question?
Yeah, I just wanted to interject, and I guess I should have mentioned that Phelan-McDermid is one of the 7 disabilities covered under APD's iBudget waiver. And so it's not that well known. And so that's one of the reasons we kind of wanted to bring it to attention.
Yeah, and I want to get into that a little bit too, because we really are, there's some unique aspects of the diagnosis in Florida, even considering that it's one of the 7 conditions. Um, so we're about half of our members worldwide, and by members, I mean families with someone diagnosed. So my family would be a member, Matthew would be that one person diagnosed, are in the United States. So we have about 3,600 members worldwide, and about half of those are in the US. So then within that, Florida is actually our 3rd most populated state with people who have a Phelan-McDermid syndrome diagnosis. So we have about 111, I counted this morning, people in Florida with Phelan-McDermid syndrome. So for a really rare disease, it's actually a pretty significant number. And of course, the larger numbers in the United States aren't because we think it's more common in the United States. It really is an access to genetic testing issue, which I'm sure, many of you involved with rare genetic disorders and other rare diseases know how that goes with access to testing. So let me see here. In terms of our mission and what we do as a foundation, it's really broken down into 3 pieces. So let me show you on our website, and then I'll dive in a little bit more specifically. So our website is really broken down into those 3 prongs. So it's connect is family support. So everything to do with that world, which is really what I do, is in that part of the website. Care has to do with improving medical and clinical care for individuals with Phelan-McDermid syndrome. So that kind of branches between family support and science, where we are trying to help people in the moment with navigating doctor's appointments, getting the best resources to their doctors, and things like that. And then we also have a piece around cure, which is working to find treatments and cures so that someday our individuals with Phelan-McDermid syndrome have a much better quality of life or aren't living with these symptoms at all. So that's kind of how we break our work down as a foundation. And like I said, my work is really directly in that family support piece. So I'd like to talk a little bit about what Phelan-McDermid syndrome is, and then I can tell you a little bit about what we do in each of those kind of 3 buckets of our work as a foundation. Any questions at this point? Okay, so I'm going to go into what is Phelan-McDermid syndrome, and I use our website as a tool with our families all the time, so I'm going to have to stop myself from getting too granular because, that's probably not going to be what's the most important to you all today. I do want to tell you on our website, all of our pictures are pictures of our families and our individuals that are diagnosed with Phelan-McDermid syndrome. So we don't use stock photos. These are all our beautiful people that have PMS and have sent in their pictures. So I really like the definition. We recently did a little bit of a rebrand and sort of simplified some of our definitions. And I like the definition we give on our website of what is Phelan-McDermid syndrome. It's pretty simple to explain it this way. So it's a rare genetic disorder involving chromosome 22 that can affect many critical functions in a person's body, from learning and communicating to eating and sleeping. Phelan-McDermid syndrome really can manifest in a variety of ways. So it's not going to be a situation where each case looks the same. It can be a very large spectrum. And there's a lot of different kind of domains or areas where you can see the effects. So there can be behavioral impacts, there can be medical effects. As our population gets older, we're seeing neuropsychiatric illness and episodes coming through. So it can be pretty complex because you're dealing with managing not only medical care, but a whole lot of other challenges as well. So it really does affect the person's entire life, and in turn does make the family face a lot of challenges, both the caregiver parents, which, will link into some of the conversation around APD and respite care and all of those types of things. The siblings, it can be a pretty challenging situation to navigate as a family. So if you're interested in digging into more of our resources at all, this is a really nice 1-page summary that just kind of breaks down everything I'm talking about into 1 page. And there's a lot of good downloads on our website as well. Basically, Phelan-McDermid syndrome is when someone is born with a difference on chromosome 22. And Without getting too detailed on genetics, our chromosomes have a P arm and a Q arm. So the P arm is petite, that's why it's called P. And then the Q arm is the long arm of the chromosome. So you'll hear Phelan-McDermid syndrome referred to as 22q13 deletion syndrome sometimes. That's what it used to be called. And that's because that Q arm is the arm that's affected. So it's chromosome 22. The Q stands for that Q arm, and then 13 is that location on the chromosome. So that's the part of the chromosome that either has a deletion or a variant. It's some kind of a difference or anomaly that causes clinical symptoms and problems in the person. So that is where those numbers and letters come from. The actual genetic, what the genetics look like can really vary greatly. So my son has a huge deletion. It's a 7.1 megabase deletion, which means 7.1 million base pairs of DNA are missing. That's about 100 genes that he's missing. And then we have people in our membership who are missing just one nucleotide. They can have what's called a frameshift variant, where they're just missing one little tiny letter and then everything shifts. Which still can have these huge impacts in terms of symptoms and what this looks like clinically. So there's not one little definition in terms of the genetics. It really can be a great variety. And we're still learning as a foundation what that means in terms of linking the genetic situation and so that's called the genotype to the actual clinical symptoms, outcomes, and how the syndrome actually looks for the person, which is called the phenotype. So we're hoping to learn more about that. But as someone who supports newly diagnosed families, I often get questions around, will my child be able to speak? Will they live independently? And there's really no way for us to predict that with our knowledge at this time. People are hopeful that we'll be able to look at the genetic report and tell them, oh, they're missing this gene, so that means this or that. And we're just not there yet in terms of knowing all those outcomes. So that kind of gets into what I just talked about, some pictures of the chromosomes and what the letters and numbers mean. The main gene you might hear talked about and discussed with Phelan-McDermid syndrome is called SHANK3. So pretty much all cases, with some exceptions, are going to involve a difference on SHANK3. In my son's case, he's missing the whole gene SHANK3. The reason SHANK3 is important is a couple of reasons. One is that it actually is a gene you can study in mice. So mice have a SHANK3 gene, and that means that there's ways to do testing on animal populations, which ultimately translates into being able to have clinical trials and potentially treatments and cures for this disorder, because we're able to look at it in animal models first. So that's exciting. The other thing about SHANK3 is that if you know anything about what genes do, they code for proteins. So SHANK3 codes for a protein SHANK3, which is a really, really important protein that helps nerves communicate. So at the synapses of nerves, SHANK3 is a protein that helps the nerves deliver the message one to another. Our kids and our adults who have Phelan-McDermid syndrome don't have enough of that protein. So one of their two SHANK3 genes is totally inoperational. It's not working because it either has this deletion or variant. And so the nerve synapses don't have enough of this important chemical to help them communicate. And then you end up with a lot of the clinical symptoms, the neurological symptoms of Phelan-McDermid syndrome, which include things like intellectual disability, speech delay, problems with speech, hypotonia, low muscle tone. That's one of our most common clinical features. Sleep disturbance, seizures, constipation actually is related to neurology. A lot of the problems that our kids have with constipation and GI issues are neurological in terms of the root causes. So it is a genetic disorder, and we are talking about a difference on a chromosome. However, if you think about how it plays out, it really is neurological. So it's called a neurodevelopmental disorder as well. So this just lists some of the most common symptoms. Um, about a third of our population will have an epilepsy diagnosis, and about a half of our population will have seizures at some point in their life. So it is pretty prevalent. The most prevalent symptom, though, really is that low muscle tone. So there's work being done to improve access to like neonatal hypotonia screenings, where, if the baby is flagged at birth as having low tone, then they would screen for things like Phelan-McDermid syndrome. So that's something that I know there's work being done on that front. In Florida, one of the things that's difficult with the Phelan-McDermid syndrome diagnosis is decreased perspiration and heat intolerance. So that can be real tricky. If Matthew's out in the sun for more than like 5 minutes, right, this time of year, he will overheat. He'll start to get like white around his mouth, and you can just tell he's too hot. So that's a challenge our families deal with, but especially hard in a hot state like Florida. I'm sure we're all ready for, Thanksgiving time to me is when it starts to kind of cool off in my mind. And about 75% of our population is diagnosed with autism spectrum disorder. I would guess that number is actually higher, but many of our families report difficulty with diagnosis because our kids often make good eye contact and are social. And sometimes if you have a more old school provider who sort of thinks of that baseline of autism about eye contact and social emotional interaction, then they sometimes are dismissive of our kids because they don't fit that criteria, even though they have, executive functioning issues, sensory issues, repetitive behaviors, lack of language and speech, all of those other pieces that can contribute to an autism diagnosis. So I would guess that number is actually higher than 75%. Okay, so these are some medical issues. If you were to do an MRI on our kids, on their brains, you would probably find some arachnoid cysts and some other medical anomalies in terms of brain structure. There's aspiration can be an issue. My son aspirates, he's on thickened liquids. We already talked about autism. There's chronic diarrhea. Often that's related to constipation, but our families are often just battling these constant gastrointestinal issues. Matthew actually has an x-ray this afternoon to deal with trying to figure out what's going on with his GI system. So always trying to figure that out. Developmental delays, low tone, we talked about. Lymphedema is one that's less common, but we do have a subset of our population that has lymphedema. Recurrent ear infections. And then one I haven't talked about yet is this kidney reflux. So our population that have those larger deletions, like my sons, are at risk for reflux in their kidneys. So urine backing up into the bladder, which can cause recurrent UTIs and sometimes needs to be corrected by surgery. So Matthew does have that, and he does have, most of the symptoms listed out. He's a pretty much a poster child for Phelan-McDermid syndrome in terms of all of the things I'm talking through. Interestingly, there's also some physical features of Phelan-McDermid syndrome. So it's not like some genetic disorders where you can look at the person and say, oh, wow, I know what they have just based on looking at them. So they're not moderate features, they're more mild. However, there are some mild dysmorphic facial features like really thick, long eyelashes. So if you looked at that picture of my son, you'll see he has unbelievable eyelashes. People are always commenting on his eyelashes. Some other features are a very round nose. They might have a little bit of a bigger ears, these very thin peeling toenails. So those are some of the mild dysmorphic features that, when you see the geneticist, they'll be looking at those things very carefully and writing them down. Okay, we talked about how common it is. We do have about 3,600 diagnosed worldwide, as I mentioned. But that being said, we do believe we are very underdiagnosed, and this is really an access to genetic testing issue. If you look at the US, Europe, Australia, Canada, that's where the majority of our population of diagnosed individuals is. But we know there are there's no reason for that really except for access to genetic testing. So we guess that there's actually about 1 in 10,000 prevalence of Phelan-McDermid syndrome. So much, much higher than that 3,600 worldwide. In terms of membership, we get about 3 new families every 4 days. So those families come to me, I then work with them and support them. And for our international families, we have global partners that we work with, and I'll talk a little bit more about that as well. With diagnosis, I'm not going to get into all of the genetic testing. It's, I don't think that's worth talking through today, but the only way to get a Phelan-McDermid syndrome diagnosis is through genetic testing. So there is no clinical diagnosis. It's not looking at symptoms. It's genetic testing. So if you know anybody, if you have anybody that you work with or support or know personally that has a child with low muscle tone, a child that's autistic and doesn't have a reason why or has questions about that, that's the kind of person that would be encouraged to get genetic testing, because you never know if they could possibly have this disorder or something else. Okay, so I'm going to stop there with genetics. Any questions? I see someone unmuted. Question? No. Okay. Just give me 1 second. Okay, so we're going to go back through these resources, and what I just talked to are kind of bucketed under that care piece of our mission. We have a lot of other things that we use to support families under that care piece of our mission as well. We have clinical consensus guidelines, which, I think most rare diseases that have a medical advisory committee would have those types of consensus guidelines, providers and medical professionals. We have some different flow charts to do with medication recommendations, how to manage symptoms with medications. We have medical advisories regarding different topics that are issued by our medical advisory committee. So all of those resources exist to help our families with advancing and improving the medical and clinical care of their children so that they can have access to the best care possible. We have a whole neuropsychiatric support piece as well, which I'll talk about a little bit because it relates to family support. So that's our care piece of our mission. In terms of our connect piece of our mission, which is really what my work is, we have a lot of different programs for our families. Our membership is free and all of our programs are free to our families at this time. So we have a new diagnosis program that I'll show you a little bit about. It's called the First 100 Days. So this is available for our United States families. Once they're diagnosed, they then are put into this First 100 Days program with me, where they have 1 monthly Zoom meeting for 3 months. So 1 Zoom meeting a month for 3 months with me and other newly diagnosed families. And it's an opportunity for us to talk through some of the resources I just mentioned, like the medical advisories and our clinical consensus guidelines, but it's also a chance for them to get to know one another. So usually those meetings have about 5 families on them, and then they get to know each other over the course of 3 months and have that support in their early days of diagnosis. So that's a pretty new program that started shortly after I started in this role in 2022. So that's our First 100 Days program. You can sign up for the Zooms, and there's a webinar as well. And then once our families are through that period, I connect them with the next person who supports them. So that's their regional rep. So we also have a volunteer network of reps, which, for smaller foundations that don't have the resources to have a whole program like our First 100 Days program, having those volunteer support, peer supporters is really, really great. We have reps all over the world who support our families. We have over 30 in the United States. So we have a volunteer rep in Florida. One of the main things that she is able to do in terms of Florida-specific support is help people get through that waiver application and get on the waiver. But we have, like I said, we have those volunteer folks throughout the world. Our foundation was founded by families. It was founded 22 years ago by a combination of families and doctors, but really that family piece is so important to what we do. So our volunteer rep network is there to not only provide resources to families, but also to be peer mentors. And if you just need someone to talk to, they're there for you. They get families together and host gatherings for families. So we're doing a virtual gathering in Florida in September, but our rep planned, I think she had 3 separate get-togethers in the spring for families in different parts of the state. And that can just be, like a potluck at a park, but it's a chance for families to get to know one another, connect with people who are going through similar experiences, because it can be really hard to be a parent or a sibling of someone with a rare diagnosis. So that's our rep program is another program. We recently started our caregiver support group program. So in 2023, we applied for and received a grant from Global Genes for mental health support. So we offer, I'll bring that one up. We offer 4 or 5 support groups every month that are facilitated by mental health professionals. This is another program that I really can't say enough about how amazing it's been for our families. We've had almost 300 individuals participate in our support groups since they started. This just shows what the flyer is like for September. So we have a newly diagnosed group that met last night. That's facilitated. Some of you might have heard of Dr. Al Friedman. He's a psychologist who's pretty well known in the rare disease world. So he's our facilitator for those more specialized groups. So that was last night. We have 2 general groups a month. One is for parents and primary caregivers of individuals from birth to 18. So trying to, focus that on the topics that come up with children, parents of children. And then the other one is for 18 and up. So that is sometimes more transition to adulthood conversations, challenges with residential settings, or some of those psychiatric issues that can come up are more common topics for those adult groups. And those 2 groups are facilitated by a licensed social worker who she's been doing those groups for over a year now. We also have a specific group to support our parents going through neuropsychiatric episodes with their child. So their child has episodes of neuropsychiatric illness, which is really, really hard. I mean, that's just probably one of our most challenging subsets in our population is those folks dealing with neuropsych issues. So they have their own group. It's been our best attended group in terms of attrition. They show up for that group because I think it's really an excellent support for them. And then in addition to these groups, we have a grief group for families whose child has passed away. That group meets every other month. Phelan-McDermid syndrome is not a terminal. We're still learning about the relationship between life expectancy and the diagnosis. However, we have had a significant amount of loss, particularly in the last 5 years as our diagnosed population has grown. And so we're, always trying to figure out ways to support those families who have lost a child. We're also having an initiative right now around, it's called the Legacy of Light, and it's trying to understand more about the individuals who have passed away. So it's a mortality review to learn more about those deaths so that we can hopefully, improve care for the future. And then we also have a dad's group that meets quarterly. So that's been a really great group. I think in our society, male caregivers need their own space to be able to have those conversations. And so that's been really excellent to have that available. So that's a little bit about our support group program. In addition to those programs, we also have 2 referral programs. One is our neuropsychiatric support referral program. So when families are going through and dealing with these neuropsychiatric episodes with their child, they can speak with a psychiatrist who we contract with, and she will help, advise them in terms of some medications have counterindications with our population. There's just different things that she can discuss with them and help them with. So she's available. She's also a Phelan-McDermid syndrome mom. So I manage the referrals to her program. We also have a genetic counseling referral program. We contract with Seaver Autism Center at Mount Sinai, and they have an excellent genetic counselor there who sees one family of ours a week. And that's a free program for our families, so they can send their genetic report, and then the genetic counselor will have a 45-minute meeting with them and help answer their questions about what the report means, and also, next steps for recommended testing. Okay, so that's our programs that are all under this Connect Family Support piece. And so that covers, two pieces of our mission as a foundation. And then the last part of our mission is under science and research. So advancing treatments and cures for individuals with Phelan-McDermid syndrome. And we just bid farewell to our lovely scientific director in July. Dr. Kate Still worked for our foundation for 3 years, and she was our first scientific director. She's gone on to work in her area of passion, which is dementia. So it's really an excellent opportunity for her. And we're currently seeking to fill the role of Chief Science Officer for our foundation. So we've interviewed a number of candidates, and hopefully we'll have that role filled sooner than later. So right now we don't have someone heading up that science piece, but there's still is a lot going on there. So let me pull, let's see, the strategic priorities. Our science budget, our budget for that cure part of our mission, is actually significantly higher than the rest of the mission. It's so important to put resources into trying to find treatments and cures for our population for the future. So let's see here. We're trying to speed the pace and progress to deliver treatments and cures. I talked about, we're helping families today, but trying to find answers for tomorrow. And then the research priorities are all listed out here. So one big priority that we still are moving forward with, even in the absence of that scientific director, is funding research through grants. So we have a really robust grant program. We just announced the recipients of this year's grants after a very, the long review period, and we had a lot of applications. So that's a really exciting way that we can move forward with research around specific topics that are important for Phelan-McDermid syndrome. So that's one piece of what we do, is funding those research grants. We collect community data. So we have a registry that's called the Data Hub. That is, information about our population with Phelan-McDermid syndrome that can be available for pharmaceutical companies and researchers, with a lot of restrictions and red tape, but that's, if we do have that. That's one piece of our research.
Hey, Carla, we do have a question in the chat. So
Yeah.
for a newly diagnosed child, what are some of the first general steps that you would suggest for parents?
Yeah, so a newly diagnosed child would probably have seen a geneticist, and that's probably how they got the diagnosis. Sometimes the diagnosis would come through a neurologist might order that. If they had not yet seen a neurologist, then that would be someone they would want to see sooner than later. I'll show you. Let me show you where this lives, and I can put the link in the chat as well. But under our medical issues and clinical care tab, there's a lot of information about the specialists and, what you would do once you get that diagnosis. I always share with new families these top 2 medical advisories, because sometimes once the child is diagnosed, they're going to have a sedated procedure, maybe an MRI or something like that. And we do have some medications that are used in anesthesia that should be avoided with our population. So these 2 links on top would be really important to share with new families. Clinical consensus guidelines are all down here, but the one that's really nice for new families to look at is this 1-page document that breaks down the body systems and how the symptoms can play out in each body system. So they can print this and bring it with them to their medical professionals and sort of talk through the different body systems. If the person has received genetic counseling, then they should have been counseled on next steps for genetic testing. So for example, if the child has a terminal deletion, they should have karyotype testing as a next step. That should all be done by the genetic counselor. If the family has not received genetic counseling, or they have not received adequate genetic counseling, then they could meet with our genetic counselor if they're a member of our foundation, and she would then advise them on next steps with genetic testing. So again, like that terminal deletion, if the report says terminal deletion, then a next step would be to have a karyotype test because you want to test for a ring chromosome. Those types of things would be things that the genetic counselor would recommend. If one of the things that would be listed on the genetic report would be around some of those screenings, like the kidney screenings. So that's an important next step for new families, would be to get those kidneys looked at, particularly if it's a deletion. The urologist or nephrologist would be the person to do that. And we don't make recommendations around, the names of the providers. The family would then have to go find the urologist or nephrologist themselves. So those are kind of where you would start, would be seeing a genetic counselor, getting connected with a neurologist, getting connected with a urologist, and then the cardiology screenings are important to do as well, just to rule out heart defects.
Great. And have you had anybody have trouble, in the state of Florida, applying for APD's iBudget waiver with this diagnosis? I mean, it is so
Yes.
it's added on. Do you help families or point them in that direction at all?
So the problem that I see the most frequently is Phelan-McDermid syndrome is treated differently than other diagnoses because there was legislation passed, I want to say 2016 or 2018, where there's funding to get folks with Phelan-McDermid syndrome on the waiver immediately. There's no wait list. So our people are treated differently and do not have to sit on the wait list, which is like huge, life-changing for our families. My son was on the wait list, or he was on the waiver a month after his 3rd birthday. It was right away. The problem is that not everyone at APD knows that. So if you call and you get someone on the phone, they might not know that exception for Phelan-McDermid syndrome, and the family might end up on the wait list. And so the family has to be persistent and keep trying to get someone who can help them, who understands the nuance of Phelan-McDermid syndrome, and that there actually is that funding and legislation related to not having our people sit on the wait list. So that's where the application's not really the problem. And attaching the Phelan-McDermid syndrome diagnosis isn't the problem. It's once that application's approved, making sure they don't end up sitting on a wait list when they should not. And that's something with our members, I've been able to talk people through it. And luckily we have a lovely support coordinator who I pick her brain sometimes with questions about, the process and how it works. But it's still up to the family to be the one to advocate and keep pushing. And that can be really hard when people have, if there's language barriers, or if they work a lot and they don't have time to call right at 9 a.m. when you have to call to get someone on the phone. So that's the biggest area where I see sticky points.
And that might be something we can kind of work toward. Do we have any other questions or comments? Feel free to unmute and ask. I know we've gone over a lot of information.
Yeah, I don't know if that was too much detail to get into, but I'm given the chance to talk about it, and we are rare, so I like to try to give as much information as I can. The only last 2 points I would make on research are that we do have a lot happening in research right now, not only with what we do as a foundation, but we work with the pharmaceutical companies that are actually developing the treatments. So right now, Neuron Pharmaceuticals is in phase 3 of a drug trial. The drug is NNZ-2591. So they've gone through already animal models and phases 1 and 2. So now they're testing the efficacy of the drug. and we can't recommend families do this or not, participate or not, but we can help families understand the process and give them access to the information, and then they can make their own decisions about participating in trials. But that drug is very similar, if you're familiar with trofinetide, which has been FDA approved for Rett syndrome. It's a similar type of drug. And then we also we work with Jaguar Gene Therapy, and they are just about to start phase 1 of a gene therapy trial, which, whether people choose to participate or not, it's just a huge door open for our community to even have gene therapy as a conversation, and as having that level of attention from pharmaceutical companies being given to our disorder. So those are exciting things coming, and those are relationships. We as a foundation work hard to, have those relationships with the pharmaceutical companies and keep our families up to date on what's going on there.
Yes, well, you are listed on our website or we're happy to have you as a community partner, and we will send out the website link after the fact with your contact information. I know that you have social media platforms for the association.
We do, and I can send you those if you'd like to send them out after. Yep.
That people can, look at and get information. So, well, we certainly appreciate you taking time to kind of educate us on this. It's definitely something that I'm sure providers and families need to be aware of.
Yeah, thank you so much. And if you don't mind, I just want to share a few. I don't know if anyone's familiar with Rick Giotti. He has a photography organization called Positive Exposure, and he came to our conference over the summer and took pictures of our families. The whole mission behind his photography is to show genetic difference as beautiful. And he's actually going to be using some of the pictures to get them into medical textbooks. So instead of having these, pictures where the eyes are blacked over and it's someone looking really sick, you have these more beautiful representations of people. So I just wanted to share some of our beautiful kids who have Phelan-McDermid syndrome taken through the eyes of Rick Giotti this summer. So our children are beautiful, and I just think it highlights, these are people that I'm talking about, and amazing families in our community. So just wanted to share a few of those.
Thank you so much.
Carla, this is Alan Abramowitz from our.
Oh, hi there.
We really appreciate this, and I'm glad we're going to put it on our YouTube channel and share it widely, including with waiver support coordinators and families in ARCA, Florida, and ARCA of the United States. So thank you very much. This was very informative.
Oh, great. No, thank you so much. And I think this is me with our founder too. I think one of the takeaways that I see with families is just that advocacy piece, helping people to system and the processes and know how to advocate for themselves. And it shouldn't depend so much on having, a great support coordinator or the right relationship with this or that person. It shouldn't be so hard. And unfortunately, it really is. So I'm available, if there's people that want to talk through supporting other rare diagnoses and helping families and any of the programs that we offer, I'm happy to speak with anyone as well. We also, one of our founders, Sue Lomez, lives in Florida with her son, Sam, has Phelan-McDermid syndrome. And then Dr. Phelan, who was that last picture, Phelan-McDermid, she's one of our founders as well. And she lives in Florida as well and is still doing cancer research down in Fort Myers area. So we have a big Florida contingency here.
That's great. Lucky for us. So again, well, we thank you so much for sharing, and we will see everyone next month.
Thank you.